It's that time of year where people are going to have fevers. And I wish people would understand that largely the number of your fever mostly doesn't matter. I mean, if you have heat stroke or malignant hyperthermia and your temperature is 107, that's a different conversation. But in upper respiratory viral season, which we're approaching, which the majority of people will have, I will tell patients that they just need good supportive care. Now, what does that mean? If you have some fatigue and runny nose and you're kind of bleh, and you have a fever of 102 and your kid, like mine, just started preschool, as a blanket statement, Tylenol, Motrin, rest, hydration, those are good things to do, right? And I'll usually take that blanket statement and personalize it based off the person who's in front of me. If they have COPD or were recently hospitalized, they're at a higher risk of bacterial infections over that viral infection. So that's a discussion worth having. If you were recently treated for peptic ulcer disease or you have bad GERD, you probably shouldn't be slamming 600 milligrams of Motrin every 6 hours. If you care for someone at home who's immunocompromised, who has cancer or is on chemo or radiation or whatever, and I think you have a viral infection, I might do one of those fancy swabs, like of the 20 viruses or whatever for you, less for you, and more for your family member. Because if you end up having COVID or the flu, that really matters to your family member who is a higher risk category. But a lot of the time, if a 21-year-old comes from college and they have a viral syndrome, they don't need the swab. It's good supportive care and return precautions. Some people feel very strongly about their own home remedies, or there's some evidence that would show that taking zinc supplements might lower your symptoms for a day or a day and a half, but that might be because the people who take those supplements are more likely to do good supportive care, to hydrate well and to take things for their fever, whatever. I usually don't get too pressed about that. If you want to take your zinc or your vitamin C or your turmeric or whatever, like you do you. But even more of that discussion, right? Like if someone comes in with bad gastritis and they're nausea and vomiting, but they had recent surgeries, or they have abdominal adhesions, or you're worried about a bowel obstruction, I'll say that out loud, right? And be like, hey, the most common thing here is you probably have some kind of viral something. However, your belly's super tender, you have recent surgery, you're a higher risk for X. This is what I'm looking for. Sometimes people think if you go to an urgent care, you're going to get Tessalon pearls and maybe amoxicillin or a Z-Pak or whatever. And if you go to an emergency department, by nature of being there, you're going to get a CT scan. And that's largely not true. We just need to do a better job at explaining what goes into our heads when we say, it's a virus, you're fine.